The Partnership for Advocacy in Child and Family Health is urging reconsideration of the 2017 proposed health budget and upward review to a minimum of 10% in order to broaden healthcare delivery services in Nigeria. It was at a dialogue with the media. Gloria Kanem reports.
Participants at the workshop unanimously agreed that no sector of the Nigerian economy will function adequately if good health is not guaranteed. Hence, their advocacy for an increment of the 2017 budget, which is 21% cumulatively lower than that of 2016 due to the rate of the naira compared to the dollar.
The people in the National Assembly have the right to adjust the budget if they feel it will be in the greater interest of the people. So in case that 1%, the National Health Act has stipulated, mandated for the Basic Healthcare Provision Fund is not in the 2017 budget proposal, we are demanding that the National Assembly should please do the right thing by ensuring it is included.
So we're encouraging the private sector, the big entities to come partner with government, just like we've done at the primary healthcare center in Kuchigoro, where we try to revitalize the primary healthcare center to make it more functional so that people can access quality healthcare services.
You cannot have better access to quality healthcare without pumping money into it. So what you give is what you get.
The Partnership for Advocacy in Child and Family is a non-governmental organization that seeks accountability and commitment of stakeholders in providing quality and affordable healthcare services in Nigeria. They focus on family planning, maternal newborn child health, routine immunization and nutrition. In Abuja, Glory Ekanem, NTA News.
Well, we seem to have issues with the pictures there. Well, still on health, with focus on funding the sector for Nigerians to have better healthcare services. I'm being joined in the studio by Mr. Sunday Okoronkwo. He's program officer with Scale Up Nutrition in Nigeria and a member of Partnership for Advocacy in Child and Family Health. You're welcome, sir.
Thank you very much.
Now let's start, our discussion with how much is allocated to the health sector in this year's budget and its percentage.
Thank you very much for having me. Currently in the 2017 budget, health sector got about 304 billion naira allocated to it. That comes to, when you compare it to the national budget, it comes to about 4.17% of the total national budget of the country. Permit me to digress a bit and go back a bit. If you look at, for example, the 2016 budget, we had about 250 billion allocated. And so if you compare it to the current one, there's a bit of increase. But the truth is, if you look at the current economic situation in the country, the fall in the naira, and the rise in the dollar, you'll find out that the increase is marginal and may not necessarily really bring the kind of needed change to the health sector, basically.
All right, let's talk about the impact of this now. You were speaking about the improvement now in the budget. What's the impact of this on healthcare delivery in Nigeria?
Well, the impact is enormous. It's enormous in the sense that even though, like I said, there's an increase, the increase is not what it ought to be considering the economic situation. And if you look at Nigeria, looking at statistics, some by development partners, data shows that every day we lose about 2,300 under fives to all manner of diseases. And also daily we lose about 145 women of childbearing age, especially during when they are about to give birth. We lose them because of probably inadequacy of some health services that they need to survive, or for example the fact that some of them didn't do proper family planning, because a woman by standard, it is said that there should be at least 2 years gap between each child in a family for a woman to be able to survive probably her next childbearing period. And so if you look at that statistics, calculate it in a year, what that turns to is that each year we lose over 800,000 children on the 5 children. Wow. Yeah, we do. And then each year, if you also calculate that number, it means we lose over 500 women of childbearing age. For a country that, is striving towards progress to meet some of the SDGs and what have you, this is a trend that has to be, reversed. And you can't reverse it without adequate funding. Basically. You can't do that. And I must say that the country, the current government is doing its best. But the truth is, if you look at the importance of the health sector and its implication in the life of women and children in the country, you find out that the health sector ought to be prioritized. Yeah. And more funding ought to go there because health is wealth. You can't talk of the wealth of the nation without talking of the health of the populace.
Now let's talk about the AU declaration and the 1% consolidated fund to health. How are we faring in those areas?
All right. Like you rightly said, in 2001, African leaders gathered in Abuja and they made a declaration to commit 15% of the total annual budget to improve the health sector. Nigeria signed on to that agreement in that 2001. But the truth is, from 2001 till date, the only time Nigeria has crossed, has done the best time we've ever committed sufficient, to some extent, some percentage that is higher than every other one is in 2012, where we committed about 5.95% of the total annual budget to the health sector. But from 2001 to date, it's been dropping. Like I said, if you look at in 2016, it was barely 4.13%. And now in 2017, it increased to 4.17%. Yes, there's increase, but it's negligible compared to the challenges. And the truth is, if you look at other African countries that signed on to this same agreement, you find out that they are doing very, very well. For example, Rwanda, a very small African country, is doing, as at 2011, they are doing about 23 point something percent. Zambia in 2011 is already, that is 10 years after the declaration, is doing 16%, and so on and so forth. So smaller African countries are keeping to that declaration, but for Nigeria, well, I believe we will do better. And then if you talk about the 1% consolidated revenue fund that was supposed to be committed to improving the health sector too, you find out that the National Health Act was signed into law in 2014. But from then till now, government has not committed that 1% that is supposed to have been committed to operationalize that particular, act. And the truth is, if you go to our hospitals, if you go to primary healthcare centers, you find out that there are so many services that are not available. There are so many things needed in the hospital that is not provided. And the truth is, it's all because of inadequacy of funding. Yeah, funding.
Well, now let's still talk about, do you think Nigeria's health sector can deliver with the present allocation?
I'll say no.
Why so?
I say no with caution. Looking at the economic situation, we have to tell ourselves the truth. Because if you don't tell yourself the truth, then you're not ready to move forward. The truth is the current allocation to the health sector is inadequate. It cannot fund adequately the several services that Nigerians need to lead a healthy life. 304 billion may look sound big, but the truth is, if you convert it to the dollars, it's less than $1 million. Yeah. In 2016, I know that we committed just also 250 billion or so. If you convert it to the dollars at then, it came to about over 1.2 billion, dollars, over 1.2 million dollars. So even though it seems as if there's an increase, face value increase of about 50 billion, the truth is the real value of that money when compared to the dollar, which is the most stable, means of purchasing and stuff like that across the world, you find out that we still under budgeted and stuff like that. And the truth is, if you look at the problems, I'll just give you a typical example. My wife a few days ago went to one of the hospitals to fix implant for family planning.
Okay.
And on getting there, the truth is that she had to go outside the hospital to buy the commodities she requires, to be able to do that. Yeah. And after that, you have to buy soap and all what have you. I'm not saying it's wrong in itself, but I don't think that's right. What of those who cannot afford it? What that means is that they won't be able to go to this hospital and get the care they need. And what does that translate to? That of people who are supposed to contribute effectively to the future of the country, basically. So that's why I say no. It's not adequate, and I hope the government will do something about it. Yeah.
Well, let's have your take briefly on your call to policymakers and health sector funding. What do you have to say?
All right, like you rightly said from the beginning, we're from PACFaH. The PACFaH project is a social accountability project, and it's focused on 4 key issue areas: routine immunization, nutrition, family planning, and also what's the 4th one again? Eradication of childhood killer diseases, with focus on amoxicillin and zinc ORS. The truth is, the first thing we are calling to the government presently, because it's still possible, it was done last year, even though the budget had gotten to the National Assembly, somehow it was reviewed, to some extent. So the country, considering the current situation, can as well do something, because if we don't increase the current, budget size of the Ministry of Health, they won't be able to deliver on their services to Nigeria. So the first call to them is we need to increase the budget allocation to the Ministry of Health. And also the child and family health sector, it's also a peculiar one, like I said.
Oh, sorry, sir. We have a limit on our timing. But so good to have you here to discuss with us.
Thank you.
Mr. Sunday Okoronkwo there discussing funding the health sector for Nigerians to have better healthcare services.